The idea came about when we looked at global tourism in terms of medical tourism, how it is really fetching countries revenue and also helps countries to actually improve on their health facilities. We thought in Africa, if we talk about medical tourism, especially in the sub-region, Ghana is also on top there. Why is it that we are not showing what we have to bring people in and also to improve on our health facilities? So we came together and we decided that, look, let's do something. That's why we came up with Africa Medical Tourism Council, to make sure that people know what we have and then we can also attract medical tourists into the country.
In the meeting, I realized that one of the advisors made mention of specific gaps that we have to break. Is it possible, as the vice president, you think in the next 5 to 10 years these gaps can actually be broken?
Well, I think so. It's all about commitment, dedication, and passion and intention. We have to be intentional about it. We cannot do it alone. We need government, we need a private sector, we need everybody to be on board. If all of us can come on board and decide that we want to do it, it is possible. What others have done, we can do it. We have the knowledge, we have the people with experience. The experience that we don't have, it is easy to get it from somewhere. If it is equipment, if it is machine, it is sold out there, we can bring them in. So why not? If we are intentional about it, we can do it even less than 5 years.
Great. And one thing also that was said in the meeting was the medical concierge and all that. I want to ask a question based on the locals. So we know that sometimes the ambulances are not easily accessible. So is there any policies or plans being made in place to get people to emergency wards as soon as possible, maybe using the Uber drivers or the Yango drivers? Is there anything that is being put in place?
What we have done so far is to work closely with the National Ambulance Service. The ambulance, I don't think they are not available. They are. But we have some ambulances at certain places that they don't need them. But of course, we need to place ambulances at everywhere. So what we've done is that if we have an emergency, then we call on them quickly. They will arrange for ambulance to pick whoever has to be picked. Then you talked about Uber, Taxify, a boat. You know, there are certain sicknesses or ailments that you have to be careful how you carry the patient, because by not carrying the patient well or by handling the patient anyhow, you can even end up injuring the person or killing the person. So we can train Uber drivers, taxi drivers at certain locations so that when it's emergency and we don't have ambulances available, these drivers are trained so that they can support. Or you are just driving and you see somebody has collapsed, the person needs to resuscitate it. What do? So these are things that we can be doing with drivers anywhere you are a tour driver or a driver guide, you are in the bush with somebody, the person collapses, what do? So these training will be given it to the drivers so that wherever they are, if there's any emergency, they will know what to do. And where they also need to call a facility, they can do so knowing that they know this hospital does this, that hospital does this. So anytime a tourist comes in and a tourist needs that help, they can easily do that.
That's very good. Thank you so much for joining us today on CHTV.
Thank you for having me, CHTV. I've been working with you and I want to encourage you to continue. I know you go far.
Thank you so much.